Hello, I'd like to introduce you to a friend of ours. Her name is Lindsay Duplanty. She's with Therapy at Home. My dad has been having therapy at home. As you may know, he had COVID and came home because he did not want to be in rehab. I was fortunate enough to know about therapy at home, and he's been receiving PT and OT since the end of January, I believe, all of February. So Lindsay is going to come and talk a little bit about sometimes patients are sent home, they have to have it, but sometimes you're in your home and you don't even realize that you need a little bit of help. So how does physical therapy in your home help someone that wants to stay in their home?
Yeah, so physical therapy, we start off with a physical therapy evaluation your first day and get a good picture of your living environment and what you need to be able to do to remain safely at home. We discuss if you've had any falls, and then we do an evaluation to see if you've had any changes in your strength, balance, if you're having any pain, different things like that. And those are all the things that we can focus on. It's very convenient for us to come in your home, so that's a wonderful option for you. It really helps us to see you getting up and down from your own chairs and in and out of your own bed, because then we can really personalize our therapy sessions. It's so different than just going to a clinic and practicing on their chairs versus yours. Everything is a little bit different and more specific to your needs.
I did hear that from Al Emmons. He told me that when you helped him with physical therapy, that he has exercises to do at home, which I've started doing because I stopped going to the gym because I didn't want to get COVID, because I didn't want to give it to my dad. He got it anyway. But I started doing my exercises, some in my bedroom, some downstairs, some in the kitchen. It's like it makes so much sense to have a routine that you can do little by little. So it is a really good idea to be evaluated, I think. And I think we don't realize that we're slowing down and getting stiffer. Probably just going to happen to all of us, right? Who should have physical therapy, Lindsay?
Yeah. So, if you start to notice an issue in your balance, if you're, stumbling as you're walking, you're having pain, there's so many different reasons that you may benefit. If you're having more difficulty with your independence completing all of your daily tasks, it's harder for you to get up and down from a chair. You're more fearful of moving around. Those are all some reasons why it may be beneficial to reach out to us.
Yeah. How do I figure out if, as a senior, that I can get in-home physical therapy?
All you have to do is give us a call. We like to make it as easy as possible. So once we know you have an interest in working with us and having therapy, we can reach out to your doctor for an order, and then we find out your insurance coverage for you.
Oh, okay. So it's that simple. So who do what I call? You said therapy at home I could call,
Yep,
or
you
my
call
provider. Who do
therapy
I
at
start with?
home. Call therapy at home, and then the other option too, if you feel you would like therapy, you can also reach out to your medical provider, and then they can refer you.
Okay. And I know when my dad went in, they wanted him to do outpatient physical therapy. And we had to ask, can he have therapy at home? And we had to ask specifically for therapy at home as opposed to another company. And they said, okay. I think sometimes it takes that extra step.
It does. And just knowing that we're out there to help anybody. We're different than home health, where you need to have more of like a nursing need. We can see anybody.
Okay. Did and this is just off kind of it's probably different for everyone, but how long do people usually have physical therapy before you say, okay, you're doing better?
Yeah, it really does vary, 6 to 12 weeks on average. It depends. If somebody's falling regularly, it may take us more time to get them back to their prior level of function and more independent. We take time to find out if they need more resources and help inside their home. Yeah.
So
And then also, if you're working on home exercises on your own, that helps progress people more quickly as well.
yeah, it almost seems like if you want to stay in your home, you need to stay physically active to be able to do the things you need to do. And it's hard. It takes a little more effort, but it's well worth it if that's your goal, to stay in your home. And even if it's not, it's to live, you need to keep moving, correct?
Correct. Yes. Exercise is so important. Just even walking during the day to keep you strong. As you get weaker, it's more challenging to do your daily activities and you're at a higher risk for falling. So, exercise is so important for your strength, your balance, your joint mobility. As you get weaker, you could be starting to have more pain, things like that.
Okay, so there's never an age where you can say, okay, I'm done. I don't have to exercise anymore, right?
It's important to keep moving as much as you can, and we're here to, show you the ways to make that happen for you.
Right. Well, I so much appreciate what you're doing with my dad and therapy at home. It's been really helpful to us as a family to see him, even though it's difficult for him to accept. You need to keep moving, and we. So I so much appreciate your help, Lindsay, and therapy at home. And thank you for taking this time to talk with us and let all our listeners know about you. Thank you.
You're welcome. No problem.
Bye bye.